back to my YouTube channel. Please subscribe, like, and share the video. So today I'm going to be discussing on Ebola. And as you've seen in recent times, Ebola has become a really great threat to our health system. So today we are going to discuss Ebola. So what is Ebola? How is it transmitted? And how is it diagnosed? And how can we prevent Ebola? So, Ebola is a fatal viral hemorrhagic illness and is due to infection with Ebola virus of the Filoviridae family. So, the disease has evolved as a global public um, menace due to large immigrant population. So initially, the patients present with non-specific influenza-like symptoms and eventually terminate into shock and multi-organ failure. So there exists no specific treatment protocol for Ebola virus, and only supportive and symptomatic therapy is the line of treatment. So Ebola earlier, it was termed as Ebola hemorrhagic fever and is a critically lethal ailment which primarily affects the humans and non-human primates. Ebola virus disease occurs due to a virus infection which belongs to the family of Filoviridae and the genus Ebola virus. So, Ebola viral disease, we can call it EVDs, as post diagnostic challenges and has been a universal public threat since its discovery. So, based on the CDC, that is the Center for Disease Control and Prevention, classification, Ebola is considered as a biosafety level 4 and category a bioterrorism pathogen with an immense likelihood for massive nationwide transmission. So let's look at the source of Ebola. So where do we get Ebola? So the source of infection, so intimate physical contact with patients in the acute disease stages and contact with the blood or fluids from the dead individuals constitutes the most important modes of transmission of EVDs, that is Ebola virus disease. So the long established funeral ceremonies in the African countries, they entail direct handling of the dead bodies. Thus, we are having significantly contribution to the disease dissemination. So, Ebola viral RNA may be identified for up to a month in rectal, conjunctival, and vaginal discharges, and semen specimen may demonstrate the viral presence up to 3 months. So, thus signifying the presence of Ebola virus in recuperating patients. So, the sexually transmitted case of Ebola virus disease has been reported between a convalescent patient and a close member of a family. So, that's a case study. So, when you talk about blood and fluid, you understand that a fluid can be like, for example, like I've said, the semen and blood. So when a recuperating patient is a patient who is in the process of recovering. So asymptomatic Ebola virus carriers are not infectious and do not have a major role play in the EVD outburst, and the field practice in West African. There have been studies in the West African which show like the carriers do not play a very big role in the Ebola outburst. So Ebola has been detected from blood, saliva, semen, and breast milk, while RNA is isolated from sweat, tears, stool, and on the skin, vaginal and rectal swabs. That that is why we are highlighting the exposure to infected blood and bodily secretions. So let's discuss the pathogenesis of Ebola. So Ebola viruses penetrate the human body through mucous membrane, skin, lacerations, or tear, close contact with infected patients, corpse, or by direct parental dissemination. So Ebola virus has a predilection to infect various cells of immune system, that is the dendritic cells, the macrophages, and the monocytes, endothelial cells and epithelial cells, hepatocytes and fibroblasts, where it actively replicates by gene modulation and apoptosis and demonstrates significantly high viremia. So the virus reaches the regional lymph nodes, causing lymphadenopathy and hematogenous spread to the liver and spleen. So as a result, you are going to promote an active inflammatory response. So we are going to have release of chemical mediators of inflammation, that is the cytokines and chemokines, cause a dysregulated immune response by disrupting the vasculature system harmony. And as a result, eventually, we are going to have disseminated intravascular coagulation and multiple organ dysfunction. Okay, so let's move on to the clinical features of Ebola virus. So, due to the bizarre and atypical manifestation in the initial phase, mimicking the dengue fever, typhoid malaria, meningococemia, and other bacterial infections, EVD poses diagnostic dilemmas. So, the incubation period ranges from 2 to 21 days. However, symptoms usually develop 8 to 11 days following infection. So the initial phase is represented by constitutional symptoms. Um, so you are going to have uh, symptoms like malaise, headache, dysphagia, sore throat, and dry cough. So as the disease progresses, we are going to have abdominal pain, nausea, vomiting, and diarrhea. So a variety of hemorrhagic manifestation and form an integral component of the late phase. So we are going to have gastrointestinal tract bleeding, which is manifest as hematuria, melena, conjunctival bleeding, or intraperitoneal bleeding. So the mucous membrane and the venipuncture site bleeding along with excess clot formation may also occur. So as the features advances with time, the patient may have dehydration, confusion, stupor, hypotension, and multi-organ dysfunction, resulting in fulminant shock and ultimately death. So, in addition to all these symptoms, we also have the orofacial features, where we have the dental gum bleeding, mucosal lesion, and odinophagia, which comprise the distinctive oral manifestation. So we may have like nasal bleeding from the venipuncture sites. So how do we prevent Ebola virus? So the most imperative strategy in EVD is to avert the vulnerable population from getting infected and limit the transmission. So these are preventing such intensive and rigorous endeavors from the government, public health amenities, medical units, and personnel. So health caregivers are extremely vulnerable and experience an augmented professional threat to Ebola virus. So the risk of rapid importation of Ebola virus into human beings can be prevented by averting the direct bush meat and bats contact. So unsafe burial procedures, uh, they have also contributed to the transmission of Ebola virus. So hence it is essential to practice safe and guarded funeral rituals to prevent the disease from spreading. In addition, WHO recommends the implementation of safe sex practices to combat the sexual transmission of EVD. Strict abstinence or proper and regular condom use in male EVD survivors at least for a period of 12 months of the symptom onset or until their semen as twice tested negative should be followed. So we are also going to have dental health care, uh, you have to look at your dental healthcare, especially for the healthcare workers, because they are also very susceptible to the Ebola virus, as they are in regular contact with the blood and saliva during the routine diagnostic procedures. So there is no documented EVD through saliva until date. So we just have to be keen and observe the oral hygiene, especially for the practitioners in the dental practice. Yeah, so that's all for today. Kindly let me know what you'd like us to discuss and input your suggestions. And kindly don't forget to share and subscribe to my YouTube channel. Thank you.